Welcome to Bedside Stories. This is episode 3. We are still in nursing school, but I want to talk about today. We're going to wrap up nursing school in this episode, but I want to talk about my big fail in psych nursing. This is probably going to be one of the more comical ones for a lot of you. I'm a little gullible, so psych, I'll be honest with you, was kind of a difficult rotation for me. So just give you a little background. Psych was one of our last rotations in our 3-year nursing program before we were going to graduate and then sit for boards. And so we were at a University of Chicago hospital. It's an acute psych unit. I mean, these were people that were in and out in 30 days. So they would go off of their psychiatric medications, have some kind of a breakdown, and then come in. They would start out in the quiet room, alone, secluded. That was the room with all the padding and all that good stuff. And they would stay there until they were no longer a harm to themselves or someone else. Then they followed this whole 30-day program for when they get their medications back on board, their blood levels are up, and then they're released back into society. And so right out of the get-go, when we got there, our first day, we got the tour of the unit like we do all the other places. Some places were thrilled that nursing students were there. Some of us saw us as a big pain in the keister because we created more work for them and they had to make sure we were doing what we were supposed to be doing. So in the psych unit, they had the nurses station was surrounded by bulletproof glass. And then there was like a seating area around that nurses station where there was place like couches and chairs and things to sit, where as nursing students, that's where we would have our quote unquote therapeutic conversations with our patients as we learned psych nursing techniques, and we learned how to conduct a therapeutic conversation. And so we got assigned patients, and mine was a gentleman who was a commercial airline pilot. He had a break, some kind of an emotional break. He was diagnosed with manic depressive disorder, bipolar, mixed depression. I mean, they've changed kind of the names and terminology over the years. But he came in with a manic episode. And so manic episode, just very, very up. Just think the complete polar opposite of depression. I mean, can't sit down, jumbled thoughts. They would laugh. They would all have this very characteristic. Now, don't laugh at me because I'm going to do this on this video, but so you understand, but they all have this characteristic laugh. They go, I mean, it's almost like a machine gun laugh. And that's what I called it. And so that's very characteristic of someone in a manic episode. And so I followed him from the day he was admitted, spent his, few days in the quiet room, and then was introduced into the community. It was a locked unit. Again, it's just a 30-day unit. No, it's an acute unit. Nobody stays there more than 30 days. And so you begin to develop a rapport with them. And one of the things with these manic depressive patients is that they're very manipulative. They try and control the conversation. They just think of how many times they've been through this. They know exactly what you want to hear. They know exactly what they're supposed to say to get what they want. We had to go through these stages of therapeutic conversations, like with the men. Okay, are they at the stage where they're safe to shave? Can you give them, a razor? Or do they, if they're asking for a razor, does it still need to be an electric razor? So, I mean, there's all these little milestones and things that they go through during that 30-day period of time to make sure that they can, go back out into the community and live independently on their own. And a lot of times the challenge is with these patients. So if you know anyone that has a psych disorder, just know that it's very common for them to, when they've been on their medications for a while and they're pretty stable, some of these medicines don't have great side effects, maybe twitching, dry mouth, and so when they're feeling okay, they feel that they don't need their medicine. So oftentimes they'll stop their medicine because they think they're feeling okay. And then they're either going to go up or they're going to go down. And so I was there. I had him for 4 weeks of my 6 weeks rotation. So he was my first client, my first patient, and I had him through the whole 30 days he was there. So when they get close to going back into the community, they do a field trip. They do an outing. And now, mind you, I'm this 22-year-old naive girl who hasn't seen a lot of anything. And our field trip was where we were taking a bus to the Chicago Art Institute. And so we get on the bus and, he's already trying to push my buttons. And I'm saying, I'm trying my best to use my therapeutic conversation and not let him get the best of me. So we're sitting on the bus and he says to me, he says, what would you do if when we got to the Art Institute, I went underneath the rope, took my pen and slashed the paintings? What would you do? I'm your patient. If I do something like that, it can't look good for you. And I didn't say anything. I took this really long pause because I know he's trying to push my buttons and scare me. And on the inside, he was doing a really, really good job. And I said to him, I said, I really don't think you're going to do that, because if you do that, you're not getting out of here. So you're supposed to be going home, 2 or 3 days from now. I said, if you pull a stunt like that, you're not going home. So I really don't think you're going to do it. And then he's just, and I was so uncomfortable sitting next to this man on the bus. And so, we get to the Art Institute and he behaved and, he actually did very well. And so he's just trying to manipulate me. So, I got through that first client. Okay. And when I say I was a big fail in psych, I did well. I was graded on my therapeutic conversation. I still did well. But where the big fail with me was, is I knew psych nursing was not going to be for me because I believed all these things. So this next client, so now he's ready to go. We still have 2 more weeks of our psych rotation. So now I have to pick up a new patient. So the first part of getting a new psych patient was to do this interview with them. And we had all these questions and all these things that we needed to learn about them. And so I was getting ready to interview my new client, and I'm feeling all, like, oh, okay, I got this. I've been doing this for 4 weeks. I got this. I got this. And so we sit down and she begins to tell me this horrible story about how her son-in-law was chasing her around in the room with a knife, that he was trying to kill her, and she's trying to do everything she can to save her daughter and to get out of there safely, and was afraid that he was going to stab them, and just going to, this was a 20-minute elaborate blow-by-blow story of this whole scene that was going on in her apartment. And so I was thinking to myself, if something like that happened to me, I might need a little psychiatric help myself, a little counseling, a little mental health, a little behavioral health counseling. And so I was writing all this stuff down and taking notes. And so at the end of the day of our class, we would meet and we would have what we called our care conference, but it was basically in our psych rotation, all of us talked about our new patients, where they were, how far they came, what we did to help them that day, and just kind of overall. So since I had to get a new patient, when it came to my turn to talk about my patient, I had to talk about my assessment and my interview and all that stuff. So I'm getting through this and I'm like, oh, this poor woman. And my psych instructor, who's an ex-Army nurse, bless her, I learned so much from her, but she was tough as nails, and she just burst out laughing. And she said, I said, well, why are you laughing? I mean, I really felt taken back. I'm like, why are you laughing, about all this horrible trauma that this woman has just gone through? And I knew that they brought her in naked when she went into the quiet room. I knew that, and I kind of reviewed her chart, but I couldn't figure out why the instructor was laughing. And she says, Pam, you're going to make a great nurse someday, but I really don't know that you should choose psych nursing as a profession. And, I'm like, what did I do? What did I do? And she went on to say that that was 110% made up. None of that happened. And the reason why they brought her in naked was because someone had called that she was tearing up her apartment, and just they can hear her yelling and screaming. Again, another manic break, another manic episode. And she was in a nightgown. And when the police got there, they wanted to take her, to bring her to the hospital, bring her to this acute unit. And she refused to go in her pajamas. And they said, no, she goes, I want to change. I want to change. And they, for some reason, felt that that wasn't appropriate. They wanted to just get her. So she says, well, if you're not going to let me change, put my clothes on, I'm not wearing anything. So she took her nightgown off and her robe, and they brought her into the hospital buck naked. And I didn't know any of this because, we had to review her, and she was brand new. So her chart wasn't put together, and they were doing orders. So I didn't have access to her chart or get to even read her admission note or anything like that from the doctor. So I was just going blind on what she told me. And I never felt so dumb and so stupid because I believed every word she said. And I actually thought that she had gone through that. And that was terrible. That was just terrible. And and so I stayed with her for the couple of weeks, and we didn't get too far in the 2 weeks. It really took a while for her meds to get on. I don't know how long she'd been off her meds, but I think one of the scary things that did happen on that unit is he wasn't my patient. He wasn't my psych patient. It was one of my peers. And so we were sitting in this common room, like I said, around the nursing station that was enclosed in this bulletproof glass. And she was sitting over in the corner with her patient. I was sitting, next to mine. And he asked my peer, the other student, this gentleman said, can you please go get the head nurse? And she said, sure. Is there something I can do? Here we're trying to be all helpful. We only have one patient the whole day. So, we're it with them. So we thought, we can try and do everything that we need to do. And he says, no, I need to see the head nurse. We get the head nurse. And she says, well, can I ask why? He said, I'm asking you one more time if you would please go get the head nurse, because I'm feeling like I want to kill someone. And we kind of looked at each other. I got this really sick feeling in my stomach. Now, mind you, I'm a 22-year-old kid. And she went and got the nursing supervisor from the unit, and he willingly was escorted into the quiet room. I don't remember or know what happened after that, but I remember the psych nurse coming out and telling us that what great strides that he's been making in his mental health, because he now was able to recognize when those feelings were coming over him, that he could actually stop and take action before he actually tried to hurt someone. And so that was kind of a reality check for me, and knowing, in these psychiatric disorders, that people can truly be violent, and all, just how complex. I remember one time we were sitting in the dining hall, and there was a couple of gentlemen. They were diagnosed with schizophrenia, and they were sitting at the dining table, and they were having a conversation, not a conversation that you and I would probably understand, but our instructor was going on about how with schizophrenics, oftentimes they make up their own words. And these gentlemen, like I said, it's a 30-day unit. So they've only had, I don't know how many days or weeks to visit and communicate with each other, but they were having a conversation in a language of their own. They were talking about the brain was called the blem. I'll never forget that. And they were having this two-way conversation. and we had no idea what they were talking about. And again, that just blew my mind when you look at the power of the brain, or when it's not working right, what it is all capable of doing. So that was my psych rotation. And I never, ever in 40 plus years of nursing, ever thought about wanting to be a psych nurse. That was the furthest thing from my mind. I always wanted to do pediatrics, but in nursing school, my rotation for pediatrics, they put us on Children's Hospital in Chicago, and they put us on the cancer unit. And that was the most heart-wrenching. Bless those people that work at St. Jude's. I mean, I applaud them tremendously. But I couldn't do it. And so I had got into, through my career, focus on geriatrics. But, you know, so now it brings us to the end of nursing school. And back then, if there's any nurses, young nurses watching this, back in the day when I took boards, it was 2 days of tests. It was 8 hours each day. We were in a big conference room, like ballroom type setting at a nice hotel downtown Chicago. The desks, like the school desks, were just one in front of the other, and just rows and rows and rows of these. And they had someone for the whole 8 hours, both days, walking up and down the aisles, looking at us, making sure that no one was cheating. It was the most demeaning, it was the most intimidating atmosphere. And now, mind you, we did this for 2 days, 2 8-hour days. We took testing to get our RN license. And that was a thing too. And it didn't matter, and it still doesn't matter what kind of RN degree you have. We all take the same board. So back then, you could have been an associate, a 2-year RN. You could have been a diploma program RN, a 3-year program RN like I was, or you could be the 4-year RN, which was the baccalaureate RN, which your first 2 years were just gen ed classes, and then your last 2 years were nursing. So we all took the same boards. And so that was my journey through nursing school. So now we've kind of brought you up, and I know some of this stuff hasn't been really exciting, but I just want to make sure that in taking you on this journey, that I kind of into the next episode, we're going to go into probably the hardest lesson I've ever had being a new nurse. And this was something that I never forgot. I will never forget her name, but we'll talk more about at episode 4. So we'll see you then. All right, take care.